If you decide to be a nurse, it can never be for the money. Anything that you do and you sign up and you say, I want to be a nurse because I want to make a lot of money. There's no dollar amount to what you do every day, because you're not only saving a patient, you're also watching a patient. You're stabilizing a patient. You're making sure that patient doesn't hurt themselves. You're dealing with patients wanting to punch you in the face because they don't even want you to help them, but you need to be there to make sure that they're safe.
That was Jenna Thorn, owner of AbsorbIV. Jenna Thorn was raised in the Bakersfield community with a father practicing emergency medicine and a mother that's held experience in several departments as a registered nurse. Her siblings are also involved in the medical community, and that was her family calling to get into healthcare. It was a natural decision to her to join their medical fleet by getting her degree and working as an emergency room nurse in local hospitals. Becoming a registered nurse was one of Jenna's greatest accomplishments, and she considers it an honor for the community to allow her to care for their loved ones in their hardest hours. She provides medical attention and holistic care to stabilize a patient's condition, maintain their status, and use evidence-based practice to treat her patients. She is a mother to 4 children, a wife to her best friend. Since she knew her husband for most of her life, she was able to adopt his family's work ethic and trade, combining her care for patients and knowledge and experience from a business mogul. AbsorbIV was born. Today, Dave and myself had the opportunity to sit down with Jenna Thorn. She is a nurse here in the community, has worked in the emergency room for most of her career. You can tell she definitely had a passion for what she called working bedside. She shared with us some of her experiences and how trying it was during COVID. And ultimately, we finally got into, because that was so interesting, into the creation of her new business, AbsorbIV. We talked about some of the different products they're going to offer. One of the ones that really stood out to me was a tension bag, and that is catered to help people who suffer from migraines. And so I know there's a lot of people in the community, and I have family members who do, and so I thought that was very interesting. Their energy bag, which was your fluid hydration with your B12s, your vitamin C. It's a immunity energy-based product. We talked a little bit about NAD. They will have that as an option. They will have it on hand, but it doesn't look like it's going to be a primary focus, at least initially. It is a very expensive treatment, very costly for them to get the materials, and so that's why it's so expensive. Later on the show, we talked about some business things that they were going to do, strategies, one of which was to create a kind of a membership-based program. They're going to offer 20% off for the first 2 months of service to all their new clients/patients. Finally, we ended it with some rapid-fire questions. We talked a little bit about her mentors, some advice she would have for her 18-year-old self, and the one thing that she'd be remembered by. Enjoy the show.
Welcome back to the Our 2 Cents podcast, the show where your local professionals sit down with an array of guests to hear their story and impart some wisdom for both business and life-improving skills. This is your place to hear business and community leaders discuss relevant topics that matter to you.
Welcome back to the Our 2 Cents podcast. This is your host, Kyle Jones, along with Dave Plivlich with the Marcom Group. He will be co-hosting today's episode with me. We have as our guest Jenna Thorn, owner of AbsorbIV. Before we get to our guests, I do want to remind our listeners to make sure to follow us on all our social medias, join our newsletter on our website, and reach out to us. We get a lot of guest ideas from our listeners, a lot of feedback on how the show's doing, so feel free to engage with us. We will be nice in return, I promise. So with that being said, Jenna, welcome to the show.
Hi, thank you so much for having me.
Before we get into your business that's going to be opening here in Bakersfield soon, tell us a little bit about your background.
How far are we going back in my background?
As far as you want to go. All the way. It's your story.
Okay. So growing up, I have a father who practices emergency medicine. So the walking around the emergency rooms, it has never been strange to me, which is a lot of like weird conversations for kids that don't understand. But lunches, bring my dad to lunch, and there's a guy with like blood all the time. And it just seemed this is what my dad does. And then my mom is also a registered nurse that's worked in many different departments, starting from OB or pediatrics and, surgery centers. So we grew up in the medical community, me and my 4 siblings, and it just seemed more of like a natural thing to follow everybody's footsteps. So I have a brother that's a paramedic and also a Marine, and then my sister that works at a different local hospital that does trauma emergency emergency medicine. And I thought, hey, why am I messing around? When I went to Cal State to do CPA work, I thought, hey, everyone needs their taxes done. It just seems fun. And my whole degree was in math. It didn't really pan out for me because math gets really hard when you get to your third year in college. And my mom said, why are you doing something that's not natural to you? You should go to nursing school. So I went to nursing school. And since then, I've been hooked on caring. And I'm also a mother of 4 kids. So it's also nurturing for me. Being at bedside with my patients has always been really comforting for me as well for them. But as far as what I wanted to do when I was little, it's always been like nurturing or caring or doing something for somebody else, that being a nurse just kind of fell onto my lap.
Yeah, so what a good fit. So did you ever have the thoughts of maybe becoming a doctor and an MD, or did you want to go that far, or did you want to stay more to the patient caring, kind of the nurturing aspect of it?
When I was 13 years old, I wanted to be a pediatrician. I decided that's what I'm going to do with my life. I love kids, and that's my goal. I want to go to med school, and I want to be a pediatrician. When I was 18 years old, I ended up being at a local high school that's Catholic, and I got pregnant my senior year with my oldest son. And when that happened, you have a lot of other things that you're thinking about. What's important? What are you going to do? And immediately I thought, I'm going to have my child, I'm going to get a job, and I'm going to go to school. So immediately I threw myself into what I was good at that time, which was math. So I'm like, that's where the CPA kind of came about. I'm like, okay, well, I'm really good at this. So my son was born in July. I graduated high school in May, started Cal State Bakersfield in September, and I just kind of went with school. And as I grew older, I understood that maybe medical school wasn't going to fit me and my family. I decided that nursing was going to be a better fit for me. I also had some education with my dad. You know, he at that time had been a physician for over 20 years, and medical, like going to med school is different now than what it was then. And the cost of going through school and what it meant with like interest rates and loans, he said, you're better off doing something that you're passionate about. I'm like, well, I'm really passionate about nursing. Be a nurse. Be the best nurse that you can be. That's best for you. Be a nurse practitioner. So it started there. And then following my other siblings, like, oh, this is great for you. And then moving forward, now I'm going to school for like my bachelor's and then my NP.
In my understanding, Bakersfield, at both Cal State and BC, we actually have pretty good nursing programs here in the Valley. Is that a fair statement to say?
I am a BC graduate, and I will do hands down, BC is the best program that you can go to. I do appreciate all my professors, and as far as the CTA professors too, that really threw you into the patient care. You can read a book, but you don't really understand the practice until you're hands-on. And that's one thing that I can thank BC for doing for me, is they threw you into the hands-on part of it as soon as possible. The analytical skills you learn as you grow through the program, and whatever you're not stronger in, you start your first job and there is a best friend that you find, and there is a supervisor, there's a charge nurse, there's an MIC, and there's somebody there that's going to support you, that you can come to them and say, hey, I'm really nervous about this. This is my really, really first time. And they're right there beside you. So you're never alone in nursing. But I can give my homage to Bakersfield College. They've done amazing things for me, my sister, my mother, and a lot of other coworkers of mine, because they're focused on patient interaction and care.
That's what I've heard. And it's good to hear that, because, you know, in our community, we don't have too many places of higher education. I guess we have Taft, we have BC, Cal State Bakersfield, some other online maybe opportunities. But, you know, to hear that we are so strong in such an area that is so important in our community is nice feedback to get. And
the passing rate for BC is exponential for when you go to take your boards.
Oh, okay.
And I think a lot of that has to do with the hard tests that they give you as
Good.
well,
Yeah.
as far as the patient care. And then on top of it, the education that you learn. Don't ever count out a community college, because we're probably, I know for sure, we're one of the best in California, and we're sought out in the nation.
That's great. And so with me, when I was going through law school or applying to law school, that was one of the things that I looked at for the schools I was applying to, is what was their bar passage rate, right, for their graduates. You know, it's nice to get a JD, but if you don't get a law license to practice, then unless you're going to go teach, what's the point, right? So that was very important for us, or for me at least, was to find a place that had a high pass rate.
Because they have the tools.
Correct.
Because they've done other people before you that they're like, hey, they got it, so they're not gonna leave me behind.
Their system,
yes.
They had a good system in place, I guess.
Yes.
Before we get too far into it, I think I know the answer, but just for our listeners' sake, can you give us the hierarchy, if you will, of different levels of nursing, like LVNs, RNs, nurse practitioners, as far as skill, experience, and education is concerned?
Okay, so we have CNAs and MAs, which in my opinion, I believe they're comparable.
Okay.
I didn't participate in doing the MA CNA practice, and I didn't get my license in either of those, but they're pretty comparable in what you can do.
Okay, and those stand for, just because you're familiar with acronyms, but maybe everyone knows. CNA is a certified
nursing assistant.
Okay, and MA is a medical assistant. Okay.
It depends the department that you're working with. I do see a lot more of medical assistants in the hospitals. There's just a broader range of what they can do. So EKGs and vitals. CNAs are more of like urgent care settings.
Okay.
So I do believe that they do EKGs, and I know that they do vitals. But as far as the medical assistants, and then when you're working in certain departments, what we expect from you is a lot higher. So if you're an MA and you're working in the emergency room, you're now transitioned to an emergency room technician, which means if you get a EKG strip and this is vital, like you have to have had the education to know that this patient is either having, an MI, they're in, a certain rhythm that is not normal to them, and this is critical. They have to have the tools to read it and hand it to the physician, and then from there we know how to care for the patient. So
okay.
They are hands-on for sure.
And then registered nurse, LVN, and nurse practitioner, any distinctions there, or are they kind of...
I praise LVNs because they are amazing to the entire medical community. There's small things that they cannot do. That's just what the BRN says, what they're capable of doing. The knowledge doesn't have to be there, but certain things like co-signing on certain medications, they can't give certain IV medications, they can't give blood products. So small things, but they can start IVs. They can give oral medications, IM medications, but IV medications, it's pretty seldom what they can do. So normal saline boluses, and those are just liters of fluids they're capable of doing, unless there is like a component, which is an electrolyte or sugar, because we have dextrose bags, or we have normal saline at certain percentages that they're not able to give to patients. But if you're doing a basic normal saline bolus, they're able to start those medications for you. And when we are clustered and very, very busy, because I work in the emergency room, they're a true asset to what we can fill in our schedule.
Yeah, I mean, I'm sure everyone has a role in the patient care, right? I mean, everyone has a job to do. But the reason I ask these questions is because I think a lot of people in the community or the general public don't have an understanding of really how our medical system has evolved. It used to be you go see a doctor, right? Your family practitioner, and that's it. But now the way it's set up is there's so many different levels of care. Is it a physician's assistant? Is it actually an MD? Is it an RN? Is it an LV? And so you see all these people, and you're asking questions that may be better suited for the MD, but if you're seeing a PA, and I know with like billing has gotten crazy where billing structure works and like reimbursement rates, a lot of practices are set up where you rarely see the MD, and if you do, it's for a couple minutes. If not, you're seeing the PA. And so I think it's important for the community to understand that there are different levels of care and education and experience, and it's important to know who you're talking to and when you're talking to them.
Yes, that's very true. And also there are complaints that you come into, and that's what we call them. We call them complaints, or the reason why you're coming to the hospital. If you fall under a category that is not urgent, that you need to be located and in the back by an emergency room physician, you will be seen by mid-level, which is an NP or a PA. Their level of practice is just as predominant. You need them. They can diagnose. They also can give medications. They also can write orders for a plethora of things. But because that you are stable and you are not critical, you will most likely be seen by a mid-level. That's in every hospital that I've worked at. And I've worked at several hospitals, and that's just how it's run, because the MDs don't only see the critical patients that walk in from the front. And we see critical patients. There's gunshot wounds or stabbings, or a man walks in and he's actually having a massive heart attack.
Right.
That doctor needs to be able to have the time to pull that patient back, and we need to be able to have a bed. So the nurses that are the first look, or they're called start nurses, whatever the hospital says that they are, they're the first eyes on that patient. That is a very, very, very experienced nurse. That is a nurse that understands critical care, that can differentiate between, I feel this way, and you see symptoms. They're on the phone right away. So the mid-levels don't touch those patients. This is beyond my scope, and this is when I need my doctor. So the doctors come out, and then we're able to pull them back. And they also take everything that's from the back, which is like ambulance traffic, which they come nonstop. But when they are called ahead, so a lot of people don't understand, I can call 911 because I don't really feel well, or whatever their symptoms are. Oh, my stomach hurts. But the paramedics do a really, really good job in the beginning from assessing the patient. Let's see your vitals. Let's see your symptoms. How have you been feeling? Mm-hmm. And we have a little phone that rings, and they call and they said, hey, we have this person coming in, ambulance traffic, A, B, C, D, vitals, symptoms. So our charge nurse, who is also has to be a very, very experienced nurse, understands this patient may not be as critical, or this patient is very critical, and we hear it overhead. This patient's coming in. This is a crashing patient, STEMI, strokes, whatever it is, septic patient. We're already ready when they arrive. So that physician, that MD or that DO needs to be available for those critical patients. So when you walk in from the front, you may need critical care, but we need those mid-levels to be able to differentiate, hey, we don't have time in the back. It doesn't mean you're not important, but you're stable, and that's healthy, and that's good.
Yes, you're prioritizing your resources.
Yes.
I guess is the way to say it. You're not saying like this person's more important than you, or you're less of.
That's what the LVN role is as far as the RN role is. CNAs and MAs are more, their role is more like task-oriented, less critical care thinking. It doesn't mean that they are not important. It's just their asset to the LVN or the RN. But the LVN is also like a mid-level version of what an RN is. Okay.
Well, thanks for giving us that quick little educational background.
We're long.
But it's important because, I think a lot of people don't realize that. And so it helps, like, the more information you have, in my opinion, the better off you're going to be. So were you in the ER during COVID? Tell us a little bit about that.
I can speak for everybody in the nursing community or physician community. It was terrible. But if you are a nurse or a doctor working in the emergency room, it was god awful. It was one of the most trying times of my life. I would have a shift where at least a patient would die. And it's awful to think about, I could have done more, but when you're at that point, you can't do more. There's nothing else to give this patient. And because COVID was so heavy hit here in Bakersfield, we had a lot of demographics that were struggling. It was hard to care for the patients that maybe weren't here for COVID, but we didn't have any room. So it was really difficult doing what we call tagging. So you have a green tag, a red tag, black tag, and you hear about it in nursing school, and these are in like catastrophic events. If there was a bomb here today, as a nurse, they're training you to understand, is this person somebody that you can save? Or is this somebody that you cannot save and you black tag them? And it felt, and I've spoken to many nurses in my same profession that understood like this was that version. You read it in books or like war stories, but it was truly tagging patients that maybe couldn't make it or didn't have a high prognosis. So you gave that ventilator to a patient that you knew could make it.
Or had a better chance of making it.
Yes. So we were down to, we have one, this person or this person. And it went off of age or comorbidities or weight or how far down they were with their COVID symptoms or whatever symptoms that it was. And that was a hard time for me because a lot of patients came in and they didn't necessarily have COVID, but they had such emergent care that the COVID patients took over that. And there was nothing left to give them as far as like medical, like machinery. Nursing care never changed. It's just we missed that time because we couldn't be there for them because these other patients were more critical, or they're not going to make it, so we have to give them their goodbyes. And families were not allowed to go into the emergency room, so things were on an iPad, or please, to our house supervisor or our director, can we have a relative, like this person cannot die in this emergency room with me. They don't care about me, they don't know me. And that was extremely difficult, very emotional. And my mom has been a nurse for over 30 years, and she ended up transitioning to a surgery center. Even today, she says, I don't know what you and my sister Leslie ever went through, because I never went through what you did on a floor in the hospital and seeing what you had to see. Unfortunately, a lot of amazing, strong, intelligent, passionate nurses had to leave bedside. It was beyond depressing. It was horrible.
Did that lead to a shortage in nursing in the emergency room setting? Because I've heard that we've had like traveling nurses and people are being transported from all over the country, the state, and it's just is that part of it? Is just because it's such a hard time filling those positions that we're pulling them from elsewhere?
Yes, because when you have your nursing degree, that's the beauty of being a nurse as opposed to being a physician. You have to go through different education. Say you specialize as a doctor in emergency medicine, all of a sudden you want to do plastics, you want to go to surgery. You have to go through courses and go back to school. If you have your registered nursing license, you're golden wherever you want to go or whatever it is you want to do. So if you say, I'm done working at the hospital, I want to do laser hair removal
in Texas, for example,
or wherever,
right.
I'm going to do that. Or I want to do Botox. I want to be educated in this. Or I decided I want to go to urgent cares or surgery centers. The hospital has been left grim, and it's very hard to get people to go back to those 12-hour shifts because of what they had went through. That the burnout has been exponential. It's been terrible. I do know that alongside me, there are a ton of travelers on all departments. Emergency room, we have a ton of travelers. At every facility. It's now become a financial gain to travel.
Paid more, yeah.
It's hard to keep the people in your community to want to do these 12-hour shifts because why? When I can go somewhere else and make more money. There's a lot of ups and downs with travelers. It depends. At this point, every nurse knows the integrity of what they should be doing and what they have to be doing. So fortunately for Bakersfield, we do have a lot of good travelers, but we also have an amazing group of strong nurses that it doesn't matter what they went through. They will never leave that part of bedside. Maybe they've been moved up to like supervisors, but they're great trainers or MICNs, which I didn't speak about. Those are the people that answer the calls. And they have to be able to have a license, a certification to hear when the paramedics are coming, what they want, and speak to the doctors. If a patient's coding in an ambulance, which happens all the time, hey, doc, what do you want to give them? They need your order. So they are so important to running the emergency room. A lot of them will never leave. They're just, this is my calling. This is what I'm doing. This is my life.
And how did you feel about your own personal safety being in that setting with people who are obviously deathly ill? And I mean, did you feel that you were at risk? I mean, was there always enough PPE equipment, or did you feel safe, or you just put yourself in the back burner and cared for other people?
I'm going to knock on wood right now. I've never been diagnosed with COVID. My husband has never been diagnosed with COVID, and my children have never been diagnosed with COVID. So what I was doing at that time or have been doing has worked. We did run out of everything. So there were things that we were reusing. Whatever we can do, if you had a long stretch of days, then you had to reuse masks or shields. And shields are easy because they're not touching like your mouth or your face. They're just covering. But as far as the N95 mask, we had to reuse and put in a paper bag or not a plastic bag, because there was some sort of, at that time they were saying there could be some contamination and then it can fester in the plastic. But you put it in a paper bag, whatever bacteria that you were faced with wouldn't live in this bag.
That was the thought, at least at the time. And you guys were using N95 masks, not little bandanas or plastic.
If we did not have N95 masks, which happened all the time, you were wearing a simple mask. Which
is really?
Those paper
surgical,
masks. And then a shield.
Oh, and a shield. Okay.
That was all you had to work with, and you just did it. Now that I'm looking back, I'm like, oh my goodness, there's so many times that I had coughing and coating in my face, and I wasn't thinking about myself. I was thinking, we need to intubate this patient. And my sister-in-law, actually, this is a true occurrence, and now, she's a supervisor at a hospital, but she ran in on a code with a patient that we didn't understand, we didn't know had COVID. But when they're running in, you are doing what you can to stabilize this patient, and secretions are going everywhere. You're doing IVs, you're starting catheters, and you're Foleys and intubating, and the doctor's right there in the face. She ended up not having a shield at that time or a mask. She just ran in selflessly, and she did end up getting COVID, and she was out for several weeks. And it makes me feel sad that people don't understand now, because it's now gone past. Like, COVID's not a thing anymore, but people sacrificed every single day to do this job, to be there for you. And I didn't even know you. If you came in, I wouldn't even recognize your face, but I know what I'm supposed to do as a nurse. And that's what you take your vow to be: caring, non-malice, and, care for the patient in all aspects, whatever it is. You put yourself second. And I think now it's turned into, COVID's maybe passed, and a lot of patients are less patient with us.
Yeah, I mean, it's passed. It hasn't passed. It's still there. I mean, we're still getting it. But
no longer a pandemic from what governments and people have said. It's no longer a crisis.
So you definitely, it sounds like, did not see the sheltering in place, whatever we did at the beginning to decrease the overflow in hospitals. You didn't, from your perspective, that didn't seem to have worked, right? I mean, it seems like the hospitals were full and no bed spaces. And so
there was a period of time when we went into shelter, and it was around May and June, and nurses didn't come into work because there was no patients, and that was the shelter in place time. So nobody left their house. With that, everybody was so afraid to leave their house or homes or whatever it is they were planned to do. They didn't go to doctor's appointments, and they weren't going to pharmacies. So we had, in turn,
elective procedures were all but done.
If it was not emergent, you were not getting it done. And then by August, we had a real flat back. Patients that had all these other diagnoses that they just weren't treating, diabetics, hypertensive, patients that have congestive heart failure. They never saw their physician during that time because they were so afraid to leave their home that it hit worse.
Yeah.
When COVID was supposed to hit bad, it hit worse because those patients weren't being treated. They didn't get their prescriptions filled. They were so terrified of leaving their home that it turned into, we have these very, very sick patients, and as well as, man, it's winter time now.
Now you've got COVID on top of that.
Respiratory issues. Wow. And now they have COVID.
I mean, being a nurse in general, that's a very difficult profession. It's not one I personally could ever imagine doing. But just in that environment, like you said, it's almost like a wartime environment. It's just, I want to say thank you for doing that. But again, I don't know how people do that.
I think that if you decide to be a nurse, it can never be for the money. Anything that you do and you sign up and you say, I want to be a nurse because I want to make a lot of money. There's no dollar amount to what you do every day. Because you're not only saving a patient, you're also watching a patient. You're stabilizing a patient. You're making sure that patient doesn't hurt themselves. You're dealing with patients wanting to punch you in the face because they don't even want you to help them, but you need to be there to make sure that they're safe. There is not an amount that you can give to a nurse. There really isn't. So a lot of people, that's why I think the traveling went, because it helped with the compensation. But if you understood what it was to be at bedside and what it is to be at bedside, you can walk into a war field. There is a patient that's homeless on the street and they have no idea what's going on, but they don't realize, oh gosh, their heart's failing or their blood pressure is super elevated. they're fighting you tooth and nail, and you're trying to figure out just how to save them, but they don't want to be saved. So you have feet going in the face, and you have people trying to punch you. On top of that, if you deal with pediatrics emergency, which is what I've been doing often now, you have parents that are like, do more, do better, you do everything, and you have that sweat. I can't even imagine what it would be like to be in the emergency room now with my kids, because I do have my dad, so he helps me out a lot with, they have small illnesses and things like that. But there's just overload of judgment on what it is to be a nurse. I needed a pillow. You were there for me. I was very cold. I didn't get that blanket. And we focus more on the customer service aspect lately in the hospital.
The bedside manner that you hear.
And it's less about the critical care. Like, you're alive and you're here. And if I'm not in your face every day or every minute, that means you're good. If I'm in your face often, that means you're not good. You don't want to see me. If you see me, that means you need doctors, you need this, you need RT, you need ultrasound, you need all these other people, radiology. And people think that if you're not talking to me and you don't see me, you forgot about me. No, it just means you're
good.
Stable and
good.
you're healthy.
Yeah.
And at this point, we got you. You're fine. We're watching you on another monitor somewhere else.
Yeah. And so I don't know about you, Dave, but from what I'm hearing from this is, I mean, it's great that we have that there. It's great that people like you are there doing that, but all the more reason to try to be as healthy as possible, to take care of yourself and not put yourself in that setting, because it's not one you'd probably want to be in.
Yes, that's true.
So did that experience with COVID lead you to where and why you're here today to talk about this business venture? Did it have anything to do with it, or was this something that you've kind of wanted? Did you always have a little entrepreneurial spirit about you, or tell me kind of what led to here?
I actually didn't at all. Following, there's a lot of people that their parents do a trade. Everything's a trade. And they follow what their parents do. And like I said, growing up and seeing my dad or seeing my mom and, being with nursing or doctors, it just felt natural. I followed what they did. They never broke the mold to think of what they can do outside of working for somebody else. Mm-hmm. And I did end up marrying a man whose dad is an entrepreneur, and he has that bug of, we can do something great and helpful and amazing, and you can still be that amazing nurse that you want to be, but you also can be that boss chick that you want to be too. That really is one of the things that drove me. And bedside being different than what it has been made me not leave, because I will never leave bedside. I will either be 1 day a week or part-time, which is 2 days a week if you're working in the hospital. I will never leave bedside. I don't want to lose the critical care. I don't want to lose my integrity when it has to do with critical patients. Emergency room is like my baby. I will always stay there. I am tired of always doing just that. And what makes me feel happy about starting this new venture and this new company is I will prevent these patients that maybe aren't very sick yet and get to them before they flood the emergency room with things that are not as critical. And that's very, very important to me. There are patients that come in often that they're not critical, but they sit for several hours. And all they need is something so small as, she needs a hydration bolus. This patient needs this, start the IV, they get their bolus, and then they're discharged. And it's something so, to them, that was so quick and so easy, that why can't I do that at home? Let's keep you healthy, relatively, and keep you comfortable in your own home. Don't come to me where the germs are, where the sticky people are, where the unhealthy people are at that time that can possibly and will make you more ill from something that you caught in the bathroom or in the chair or whatever it is. And I did have recently my Grammy that passed away in October. Being at that type of bedside with her, she did like minimal hospice care, and, with my siblings and my dad, we did a lot of her care with her and for her. It made me realize how important it is to never lose that patient care. You never want to be too callous. And I was becoming very callous. So
just jaded a little bit from, desensitized to what,
Yes, to what the patient is feeling and seeing the family members and being that person for the very first time, losing somebody in that way, really pivoted what I wanted for AbsorbIV. AbsorbIV was originally going to be Drip and Lounge because I thought, hey, there's so many people that, hang out and they're having too many cocktails and they just want to chill and they need an IV to rehydrate and they need vitamins to make them feel better. There's the clients that overdid it and now they're vomiting, so they need this anti-nausea medication, and that was where the whole concept came up with. And then after my Grammy having this random diagnosis out of nowhere and sitting with her, it really transitioned to, I cannot gravitate to only those people. If you're not feeling good, I want to be there for you. And I don't want you to have to sit in the ER for several hours. I want to be there for you. But I also want to be there for the patients that they understand they need me and I need them, because it keeps, me healthy and me knowing that I'm doing something positive for somebody else.
So that was the pivot.
That was the pivot.
And so AbsorbIV, are you going to have a brick and mortar? Is it purely mobile? Both?
For the start, we are doing mobile.
Mm-hmm.
We do want to have some sort of storefront, brick and mortar, so then people can come to at one point. That I want to turn into more of like a medical spa.
Mm-hmm.
I think that we don't have anything like that in Bakersfield where you can go and do a wet sauna or a dry sauna, as well as going to a warm pool or a cold dunk, and then a salt room, and keeping it more holistic care, and then still being able to transition, hey, I still need this, and there's a medical care on the other side. So that is my true vision. That's always been my vision. And finding somebody that can do acupuncture and Eastern medicine is still very, very important, as well as Western medicine. So I want something that's in the middle of both. Really.
Takes the best of both worlds.
Yes.
Yeah. So the mobile, are you going to launch an app? Are you going to have people call your cell phone to book on a website? How's the scheduling of this going to look?
Everything's going to be through our website, and
Okay.
then we have a cell phone, which is, I can give you the number right now.
Sure.
But everything's going to be through the website, and you book your own appointments, and you pick the treatment that you would like, and then a nurse will come to bedside at your home. And there's other few perks that you're going to, you'll endure it one day. We'll go to your house. But other things that we want to make you feel very comfortable and relaxing, as far as like aromatherapy and, facial massages. And that's added into the treatments that we want to give to our patients. A lot of people are afraid of needles. So as if we can divert
Danielle's
them.
shaking her head over here. that hit home.
I've done the IV drip twice, and I look away and just okay, you done? Okay, cool. So
Yeah, I don't. The going in part is what bothers me personally. Like once it's in, I'm fine with it, but the insertion of it gets me a little squeamish.
Yeah.
But I've had probably, I think, six or seven.
I did. I've done two. I did one in September 21 before I went to Alaska, just to kind of give myself a boost before I got on that plane, because I didn't know what to expect. COVID was still kind of going on there. So
yeah,
it was a good thing. Felt great.
Do you have like a list of what you're offering or do you have it memorized? Is it going to be just like a basic saline solution? Or you can do like Myers cocktails, like immunity boosters,
we do have a menu.
Okay.
There is the basic hydrating infusion bag, which is a liter of fluids that you will get intravenously, and that will help you if you're feeling dehydrated, you're not able to have as many fluids as you would like, or say you have symptoms like, oh my gosh, I can't keep my bowels together. This will just at least keep you hydrated till you feel comfortable to get past whatever virus you're dealing with. We also have an energy bag, which is going to contain the normal saline bolus, as well as a B complex, folic acid. And then we have a tension bag, which is for patients that struggle with tension migraines. And this happens very often in the emergency room, which is why I kind of built my menu on what I've seen, because they cannot control these horrific migraines, and we do something so simplistic that they're able to leave within that period of, hopefully within 2 hours, but it never works that way. So they're there for 6 or 7, 8 hours. So it is a anti-nausea medication. It is a pain medication as well as hydrating. And then we also have, I think, a hair, skin, and nails is the last thing that we're working with. So biotin, growth on, that's more of a cosmetic bolus.
Aesthetic, yeah.
Growth in hair, skin, and nails, and then, throw in a vitamin C for vitamins for you as well. There's a few other medications that we're working with ordering that are not here today, but as of launch, we will have those bags that I mentioned.
So you said it helps with migraines?
Yes. Our tension bag is going to help you with headaches and migraines. There's a few medications that we're going to give you with the bolus bag that you will feel so comfortable and relaxed that migraine is gone.
And so how long does that last? I mean, I know a couple of people that get migraines.
Yeah, I was going to say that. I have a ton of people who I'm refer you to as soon as you're open who struggle with those.
So we do have a medication called, it's Benadryl, diphenhydramine, that we have a smaller dose that we give IV that will help you with the being able to sleep factor and just kind of relax. The Toradol that we're also adding to that bag is going to help with the pain. And the hydration is just going to keep you hydrated in that time, because when you're not feeling well, you're not drinking, you're not eating, you're feeling like crud. So it is helping you as far as like electrolyte wise with our normal saline bag, as well as the symptoms. And then we'll also add some Zofran in there. That's for nausea, because a lot of people, because I struggle with compact migraines, they're also going to feel a lot better because that anti-nausea medication, now you're able to drink and eat things a lot easier without wanting to throw it up right away.
Sure. Wow.
So with the tension bag, is that something that's like going to be like a maintenance thing where people who do suffer that regularly do it like a once a month thing, or is it something like as needed when it comes on, a treatment for it?
It's more of a rescue, what we would call treatment.
Okay.
People that struggle on a daily with migraines, they're already on other prescribed medications, but there is a point where you hit a wall and those medications are not working. My mother-in-law has every medication you can be prescribed for her migraines, and there are days she can't get out of bed and she can't stop throwing up. She can't feel like doing the things that she needs to get done. That's more, directed towards those patients that need it for that time, so they can get that rest and the hydration and the pain just taken away for that time. And then it passes. Migraines are not consistent.
Right.
So it's for that really, really intense
acute
pain. Yes.
Yeah. Okay. And is this covered by insurance? Is this cash pay?
It is going to be cash pay.
Okay. So have you decided on price points for any of these? Is that still being worked out, or can you talk a little bit about how that's going to run?
We do have price points, and you can check it on our website.
Which is, we haven't even heard the website yet.
It's AbsorbIV.com.
Okay.
And you'll be able to pick your bag and pick your infusion and your treatment. There's also going to be an add-on menu for the patients that maybe decide, I don't really know what I need, but I don't feel great. So I just want a hydration bag. And then the nurse comes to bedside, and all of a sudden they're like, oh, well, I'm also, feeling very tired. And that nurse can, recommend, oh, let's get a B12 injection, or let's get a B complex injection. Or a patient's like, oh, I'm very nauseous. Let's add some Zofran, which is an anti-nausea medication. Let's add those to your bag. That patient at that time everything's fresh. It's basically made to order for you.
And so the nurse who's coming to bedside will have all that with them.
Yes.
Mobily, so if someone does add on something after they've ordered on the website, they can do so when the nurse is at their home.
Yes.
Okay. Did you mention anything about an immunity bag, or is that kind of the energy bag, or do you have something that's like CED, zinc based that's going to help someone who's come in before maybe cold and flu season and, hey, I really want to.
So the energy bag is composed with all those vitamins that you need during cold and flu season. I think that a lot of people have been using other companies that have advertised multiple bags that will do the same thing, but different prices. The energy bag will do just great for you right before cold and flu season. It's the same vitamins, it's the same electrolytes, it's what other companies are doing. We just aren't offering multiple bags doing the same thing. I want to keep it simplistic. I want to keep it easy for my patients to sift through. Because when you see a website and there's 12 bags, you're like, oh, I don't know. I kind of feel like cold and flu, but I also feel like I need energy. And it's very simplistic. There's no hiding behind what we're doing. And the education is what's more important for me. Going to bedside and talking to those patients. This is why you chose this. Oh, let me tell you what it's going to do for you, how it's going to help you, how you're going to feel better, what it's going to do naturally for you after this intravenous medication's finished.
And I haven't looked at the website yet. Is it up actually? Is it up?
We have a pre-sign up as of now.
Okay.
And then when this launches, we'll have our open menu.
Got it. Now, are one of those going to include, so I've the two I've talked to that I've done IV bags before with for the NAD. Are you going to have that as an option? The two that I have, the price point on it was so ridiculous. I was like, well, I'm not really trying to get that experimental with it yet, but I've heard a lot of good things about NAD for preventative purposes. And so I'm wondering if you're going to have that as part of your menu option.
Okay, I'm going to be very careful with this communication. The NAD, as far as what research does and everything that it has been proven medically, is supposed to enhance like genetic genomes. And it's supposed to, if you have muscle breakdown, it's supposed to rejuvenate those things. It is a very, very expensive medication that they're allowing people to order and purchase, with a physician's order. There is plans to order those medications, but because of how high they sell and the pricing, it makes me feel like I'm canceling out what people can purchase, because the bags are up to $800 with other companies. And that's because what they charge the company to purchase the medication. I can do it. If there's a request, I definitely will have a couple of those on hand always, because it's always going to be around. If you hear about it and there's a hype about it, you want it. Right. So I want to make sure that my patients have what they want. It's just the price gouge on what they sell it for to you is so exponential that you can't really cut as many costs as you want to the patient. And I don't want to have the patient. Well, that's more of a cosmetic thing. So you're kind of like
right. It's
purchasing
preventative. I mean, I guess cosmetic, preventative, whatever you want to call it. It's not like an acute need because right, you're having migraines.
And those are more for people that are like heavy exercisers and they work out very often, or no, it's mainly for those, though it's directed towards those people that are very athletic and they have a lot of muscle tissue breakdown that you need this for rejuvenation. That's where it's gravitated. And I think a lot of the IV infusions have been influenced from what they're selling in other cities, down south.
Big cities down south.
And those patients are a lot more active and they're a lot more trendy. There's many things that I want to do with my company. It's not just intravenous medications. It's not just hydration. It's not just giving vitamins to you that you are lacking. It's also, I'm partnering with people that are also want to have you work out and do the other things that your body needs to be doing naturally. Right. You can't have everything based on what you're consuming. It has to be a life choice to let's go on a walk. Let's find a company that's going to help me with stretching or, quick climb classes or bicycle classes or Pilates. If you put those two together, you're going to feel really great mentally. Everything is going to be holistic for you. You can't just shoot a person with something and say, you'll feel good tomorrow. You need to feel good because your mental aspect is wanting you to feel good too. I want to help the patients that are feeling sick or ill or down at those times for sure. Or, hey, I had a really, really long night and I need something to help me today.
Grapes of fire, right?
I can't life today. I definitely am there for those patients as well. But if we combine the community with the eating better,
I was just going to say a dietitian. I'm sure maybe part of your team at some point,
yes.
or right. Mm-hmm.
And the regimens together, everybody in Bakersfield is going to feel a lot more healthy. But we're also going to expand to other places. But it's who you partner with and what you want. It's not about the money. It's not about just intravenous medications. This is about changing the aspect of what medicine is and what it can do for you when you combine not the crazy, like working out insane and you feel sick, but going for a walk or choosing this over that, giving you the energy to do this and not that. That's what I want to teach my patients. It's education. Nurses never stop educating. I will never stop treating a patient and will never stop educating what you're giving to the patient. Turning it over. This is what you also can be doing besides this.
Yeah. So I hear the short answer to my question about NAD is yes, but that's probably not going to be your focus, at least initially. Is that a fair
It will
summary?
be available for purchase. My drive is to keep it for people that can afford it.
Yeah. Okay. Well, that makes sense. Something you said really stuck out to me, and I think it's really important. And it really comes up with just really a lot of different areas in life. But what you're saying is kind of you're wanting your patients, your clients to really take control of their health, right? Take control of their both mental and physical health. And our medical system is not necessarily set up for people to do that. Unfortunately, it's meant for acute care. It's centered around pharmaceutical companies and their bottom line, which are the shareholders of that company or those companies. And I don't want to be too negative on that system, because when you're dealing with a large amount of people, you have to have some system in place that treats these acute people or people who are generally unhealthy that need kind of quick care and maybe need these pharmaceutical drugs. But what you're providing or what you're offering, or it sounds like what you're building towards, is a way to not need that. I mean, hopefully, right? I mean, obviously heart attacks happen, cancer. Crazy things happen, but generally speaking, what you're promoting is like, let's keep you in this lane and not going down this lane. Is that fair to say?
It starts with education. A lot of people don't understand what they're consuming or what they're doing. They don't understand how harmful it is to them if you're on the spectrum of always eating unhealthy and fatty foods and you're not seeing a primary care physician. My job has always been to educate. Let me teach you on how we can keep you healthier. Let me give you examples. Let me put you with the right people. And that is always going to be my goal. In Bakersfield, I do feel like they're not educated properly. The funding or whatever it is, they are not aware of what they're doing to themselves is harmful. And a primary doctor is not to be there to save you. They're there to watch you and control your lifespan. Hey, by the way, last year, this is what your numbers were when it came to diabetics A1C levels or cholesterol levels or patients that...
blood pressure.
Whatever
right.
It is. They're there to watch you. And a lot of people, I feel like, wait till last minute and they rely on them to save you. What I want to do is change that dynamic. I want to help you. I want to prevent you clogging the emergency room. I want to prevent you from waiting those hours to see a doctor that's going to do something for you that I'm already giving you. And the physician that I'm working with has the same vision as I do. We would prefer the emergency rooms not flooded with these patients that maybe don't need that care. They just
that level
need
of care, right?
Education. They need a friend. And the nurses that I have hired, that I'm working with, that I've vetted, that I've been bedside with, that I've seen their education and their knowledge, all want the same thing. Everything is education based. You have to be educated on what you're giving and what you're getting and what you're asking for. That's basis of what I want my company to be or what it is.
How many nurses will you employ, or I don't know if they're independent contractors, employees, but how many nurses will be under AbsorbIV? At
this point, we have 6 nurses and they're contracted with us. They're also finding their own friends and family and things like that. But they're nurses that I've handpicked and selected to work with my vision, to be able to educate the patients and care for the patients in the way that I want them cared for.
Dave, I'm sorry I haven't let you get a word in. As you can tell, this topic is very interesting to me. My mouth
I'm good. Man.
My mouth has kept running, so I'm sorry.
No, I find it very interesting as well.
So I have one more I want to ask, and then Dave, I'll turn over if you have any questions or follow up. But my last one that I have that was interesting to know about is whether or not you're going to have some sort of, I've seen this a lot now, it's kind of a new thing with new startup businesses, is having some sort of like membership model or, initial founders where the first 50 people who sign up and become members, they get, they have access to certain things or discounted prices if they come 3 or 4 times a month or 3 or 4 times a quarter, whatever it may be. Do you have anything that you're working on with respect to that?
It's super funny that you say this because I'm learning to mold into the business owner as well as the bedside nurse. And I was talking to my oldest son and he said, Mom, you know what you have to do? You have to make 50 cups. So whatever tumblers or whatever it is that you want to do, put your logo on it. And for the first 50 customers, give them this cup. And then when your year anniversary comes, all those 50 patients, we call them patients, their clients' patients, are going to get a free infusion. That is so cool. To me, Mom, they're going to remember that cup and they're going to think about that cup. And it's going to be, if you pick the right cup, you're going to see somebody else that sees that cup, tumbler, whatever. I'm like, oh, that's a great idea. So that is, we are now taking from my 13-year-old.
Nice. Hey, good ideas come from everywhere.
We have a subscription-based month-to-month payments on certain bags that you can get and as a certain amount that you can get in those subscriptions. I do want to advertise the first 2 months a 20% off discount to those first patients that come in those first 2 months. So when this launches, those first 2 months, those patients are going to get 20% off their treatments.
Very good. That was my question, Dave. So
it works. I believe you bandaged my foot one time on a bus when I cut my foot open and we were coming back from a soccer game or something. That was you, correct? It was.
How'd you do?
It's a long story or something. The bus kind of jerked and stopped and my flip-flop came off and I gashed my foot open and she doctored me up. You remember, huh? Yeah.
Is that a question or more of a statement?
That's more of a trivia statement. Did you know?
I do also want to say that this is a family-run business because my mom is a nurse and my sister's a nurse also. They're going to be with me.
Oh, so they're one of the 6.
Yes.
Very cool.
Good. And then my sister-in-law is also a nurse as well, and she's going to be a part of this. And that's what's so important to me because I love family-based businesses.
For sure.
I think it keeps it super personal and keeps us all together, and we all want the same thing, and we've all been doing the same thing because they're emergency room nurses, and my mother does surgery center work like post-op or it's still kind of emergent because you never know what's going to come out of the post-op, and she does ortho care, so you never know what's going to happen, and we all just want to work together and do a woman-driven business.
Very cool.
Care for the people.
I think it's important to ask this now, actually, because we're talking about all the great I mean, I've done IV, like I said, a half dozen or so times. I love it. It's great, and it's so cool that you're going to be doing this, and I know you, so that's awesome. Or I know you now. I just met you. But is there anyone who maybe because we're gonna as your company opens and you launch, you said 20% off for initial first 2 months for people come utilize their services. I think Olivia talked you into maybe even doing a giveaway for our listeners, hopefully.
Well, yes, we're definitely going to do a giveaway.
Right on.
We'll have to do a basket giveaway, something fun.
Awesome. So with that being said, and it's all is there anyone, and for who listening, maybe this is not for, is there, if you, any health history, if you're, I don't know, a blood factor, anything that people need to be wary of before utilizing your services or talk to their physician or get a consult with your partner, for example?
So to keep everything customer service also related, there's a lot of companies that come into Bakersfield and they don't see you, they don't know you, and you check a box. And they'll ask you a plethora of questions. Do you have this, 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 and this, and this? And you just read at the bottom and you check a box. There's 12 to 15 to 20 boxes that you need to read through. Nobody's going to read through all that. And you might be consenting to something that maybe you didn't know because you're flipping through because you're tired or drained or thirsty or whatever it is that you're going through that you're like, I'm just going to check this box. I'm just going to come to my house.
Right.
So the physician that I'm working with is super on scale with me, and they want to do a lot of patient care as well as the treatments. So you will have the consent box that is going to be I don't have this, 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 and this, and this. And then you also have a 1 to 2 minute consultation with the doctor. And that's a face-to-face Zoom conversation with him. And he can ask you several questions to make sure that you're a candidate for this, because some patients will not be.
Okay.
If you have a certain comorbidity or pre-existing disease, we might not be able to treat you.
Got it.
So you have to fit the criteria for the treatments.
And is that Zoom call going to be something that, so when you book when you go to the website and you book, you schedule that, I'm assuming before they come to your home, right? So is it going to be like available the day of? So if someone really wants something today, or I got a bad migraine, they go on your website, they fill it out. Is there a chance that they may not be able to get that treatment because the doctor's not available, or how's that going to work?
So that's why it's super important for our clients and our patients to pre-register, because now we have a list of those patients that the physician is going to call prior to. And now you're an existing patient and we will treat you.
Got it.
If you fit those boxes. If you are one of those patients that I didn't know to sign up, I don't feel great, I'm throwing up, sign up, and then the nurse at bedside can still give that Zoom conversation with the physician.
Okay. So it's not going to prevent you from doing it, but you're encouraging definitely pre-registration, become established.
Check all the boxes before, and from there, let's just get it done. Before you even need us, we want to make sure that we can treat you right away. It doesn't mean those patients that need us sporadically or out of nowhere are not going to get treated. We're going to treat you. That will either be 2 minutes before your infusion when I'm at bedside, or he'll be able to call you if you scheduled it for a certain time before.
Got it. Okay, that makes sense. And so the Zoom call or the consultation is just to become established as a patient, not every time you get a treatment. Okay, that makes sense.
Once you have met the physician and once we are establishing you as a client, as a patient, I'm going to come see you every other week.
Perfect. Okay. All right. Thanks for coming in. I do have some questions we always ask, and I think you got a little heads up on what they're going to be. Fun questions, not unrelated to the business or you, but just definitely you, but not the business per se. But we call them our rapid fire questions. So do you want to ask them all day, or do you want to switch back and forth, or just leave it to me? All right. Yeah. Who is your biggest mentor?
Okay, so I'm going to be honest, I didn't pick these questions.
Oh, good. Awesome.
Is it okay to have more than one?
Of course.
Okay. It depends what you're talking about, but everybody says my parents, but definitely my dad, my mother, and my father-in-law and my mother-in-law. They have taught me different aspects of who I am today as far as the medical community and caring community, but business life and what that's going to be like, and the integrity that you have to hold while being a business owner, which I never knew was such a big deal. All four of them are so inspiring to me. So there is not one, there is four.
Okay, then I'll change it. Who's your four biggest mentors? And then you just answered that perfectly.
There you go.
All right. If you could turn back time and talk to your 18-year-old self, what would you tell her?
When I was 18, I was walking past the Garces graduation line pregnant with my first son, realizing I'm not going away to college like I had hoped to do. I'm not going to play soccer anywhere, and I got nothing else. My husband, or my boyfriend at the time, was away at college and playing soccer. He's maybe won't come home. You're gonna be fine. Do exactly what it is that you want to do, and you will do it. Don't derail. Don't think about anything else. Whatever you put your head down and work very, very hard to do, you're going to do it. And in the midst of that, I had multiple children. I had, milestones with my own husband, that I was alone often. And I still am mesmerized with God's benevolence that I've made it here today. There's no reason why I should be here today. I did all the wrong things, and I'm still here working very hard, caring for my patients, caring for my husband, caring for my kids, caring for my home life. And you can do it. You can do anything you want to do.
Yeah,
you really can.
What you said is perfect, because no one's perfect. None of us are, but you can do the right things. And that surely makes up for a lot of bad choices or bad decisions or things that we're imperfect on. Yeah, absolutely. Okay. If you could be remembered for one thing, what would it be?
I guess I would say caring, but that sounds very basic. My perseverance, to be honest. I have done something that on my side of the family, they've never been able to do. They fit the mold, they clock in and they clock out, and they do what their trade says that you're supposed to do. And as far as watching my, husband and, my father-in-law and his wife, they set their trade on a different path, but it's not education. It's not patient-based. So perseverance is most important to me, and showing my kids that you can go to college and be that bad queen or king, but you also can be the caring, loving, soft side of life. You don't have to be the business mogul. You can be the loving, nurturing, caring, embracing person, and you just keep moving forward. You'll do it.
Yeah, and that's important because with what we set out to do with our podcast initially, and we thought, who's our target audience, and it was entrepreneurs and or business management level position or professionals, and they're really two different things, because there's a certain mindset of someone who just wants to go do their job from time X to times Y, get paid, and they're content with that. And there's some people who are on the other side of that spectrum who are like, I'm so far outside the box. I'm a serial entrepreneur. Dave's one of them, and we'll tackle and do anything, right? And then there's also in between, right? There you can have some and I think you've kind of fit that mold nicely. I mean, you are going out on your own and you're doing this new business venture. You have some entrepreneurial spirit, but you also have that side that you want to be bedside, right?
It's very scary though.
It's so fun though. It's so fun.
You've met my father-in-law. Yeah. He's like you got to do what the confidence is what I needed to do this transition. My dad is so extremely confident in what he does. He's one of the most amazing emergency room physicians that I have ever met. I have not had the opportunity to work with because he ended up moving to a different state, but he is so incredibly intelligent in what he does that they're super similar. Mm-hmm. They just do it
differently.
Yes.
Yep.
So my dad's like, do what it is that you want to do. I couldn't do it because I know that I had 5 kids and this is my structure. I needed to do this. My sister's like, I'm super excited to work for you, but oh my gosh, like, how did you do this? And, same with my mom, like, super proud of you, no homage to me. I'm like, no, because she's her own bad queen doing what she had to do with all of us. And looking over at what my father-in-law's done, it's crazy to think about what you can do with something so small as a computer, or being loaned a small amount of money that means nothing to anybody, and what he was able to grow. So the intelligence, learning like what it is to educate your patient and being that amazing doctor, with being that BA. I want to do this with something that I have nothing. I want my kids to have both.
Yes.
So
And I'll speak for any entrepreneur out there that you can't be afraid to fail. And I don't know any entrepreneur who has not failed.
Absolutely.
And not to say to go into your venture, with a negative lens or anything, but you can't be afraid to fail. And if you aren't afraid to fail and you're not afraid to try and you work hard, which it sounds like you're tremendously hard worker.
I get that pep talk all the time. Like, it's going to be okay. I'm
true.
like, what if it's not okay? No, it'll be okay because you're going to be okay. You are a great nurse. Oh, you just never know what you're stepping into. If it's open ground that you're like, you put your foot in the puddle and then all of a sudden you're playing in it. So
we talk a lot, entrepreneurs, the more entrepreneurs you talk to, there's a gene inside of us that we can't suppress. We cannot suppress it no matter how much people wish we weren't. This we are.
Yeah.
So
well, I'm learning the gene. Yeah. My gene was not given to me, but inherited to me. So I'm hoping. No, I know that success isn't a monetary value. It's a mindset. Yeah. So the things that I want accomplished, I've already been doing it till today.
Right.
That everything else is just going to be gravy.
Yeah,
it's just bonuses on top of all the good stuff.
I can hear you're passionate. You're obviously extremely passionate about your profession, your clients / patients, and so I have no doubt you'll do tremendously. So, thank you for sharing the last hour with us. I enjoyed speaking with you, and I look forward to seeing how well this takes off.
Oh, I appreciate you both. Thank you so much for your time.
You're welcome. Take care.
Thanks for coming.
All right. Bye now.
The show has been brought to you by the Law Office of Kyle Jones, Troy Burton with the Lynn Company, CPA John Duffield, Scott Hansen Real Estate Lender, broker and investor, Dave Plivlich, President and CEO of the Marcom Group and MarcomBranding.com, and Amanda DiGiacomo, President of Atlas Financial Solutions. You've been listening to the Our 2 Cents podcast. Check out the show notes for links and more information about the show. Also visit our website at our2centspodcast.com or catch us on Instagram at Our 2 Cents Podcasts. If you've enjoyed this podcast, please subscribe and share with others.